Welcome to Your Health. I'm your host, Rhonda Alfred, and joining me on this episode is Dr. Ugo Ezema, a pulmonologist and critical care specialist at Terrebonne General Pulmonology Care. Today, we're going to be talking about asthma and how to manage this condition. Welcome to the show, Dr. Ugo.
Thank you. Pleasure to be here.
All right. Well, for those who don't know you, please tell us a little bit more about yourself and your role at Terrebonne General.
Of course. Again, thanks for having me. I'm Dr. Ugo Ezema. I'm a pulmonologist and critical care intensivist here at Terrebonne General. I help with the assessment, management, and treatment of lung issues and diseases. And part of my training is also in management of patients in the ICU.
Okay. And today we're talking about asthma, so let's get started.
Absolutely.
What is asthma?
That's a really good question. Asthma is one of the, if not the most common disease that we take care of in the pulmonary clinic, in the lung clinic. Asthma is a disease that makes it difficult for you to breathe in and breathe out air, so having air move in and out of the lungs. It's a chronic disease, so that means you live with it on a day-to-day basis, and it can be very serious and sometimes life-threatening. But it can be managed to help our patients to live a healthy, full, and normal life.
Okay. So what are some causes of asthma, symptoms, and an asthma attack?
Great question. Some of the common causes include triggers. So what happens in asthma is that our patients have an inflamed airway, so their lungs are hypersensitive. The airways are thick, and a lot of the air isn't moving smoothly as it normally would in you and I. So what happens is, in those particular patients, when anything that the body is not used to, dust, sometimes perfume, sometimes exercise, cold air, these things can exacerbate the airways and have them more inflamed, producing more mucus, and make it even thicker and make it harder for air to move in and out. And that is what causes an asthma exacerbation or asthma flare-up or an asthma episode. And part of the training and education that we have with our patients is recognizing these symptoms, recognizing these triggers, and trying to avoid them.
Okay. And at what point should someone seek treatment for asthma?
That depends on the patient, but really at any point where the concern becomes that this is affecting you on a day-to-day life, if you're having shortness of breath, cough, symptoms that are becoming persistent and are interrupting your day-to-day life, I think that warrants evaluation by either your primary care doctor or a pulmonologist, a lung doctor.
Okay. And what is the difference between a controller and a reliever?
Great question. A controller and a reliever, those are the two main types of inhalers or medications that we use to help alleviate the symptoms of asthma. A controller is a maintenance inhaler, an inhaler that you take once, maybe twice a day, that covers you over the length of the day and over the length of the night. A reliever is exactly as the name says. A reliever relieves your symptoms more acutely, so in the short term. Pharmacologically, the difference between the two is that one lasts longer, the controller, and the reliever lasts a little shorter, but it gets the job done almost immediately.
Okay. And what are some physical activities that are suitable for people with asthma?
I would like to tell my patients, as long as your asthma is controlled, you have no limitations. Our main goal is to get our patients to a place where they can live, again, a normal and healthy, full life. Sometimes before getting or achieving control, then you might be limited from an exercise or exertion perspective. But once you're on the right medications, once you're on the right treatment, the right inhalers, our hope is that you have no such limitation.
It's manageable.
It's manageable.
So
Yes.
what are the effects of smoking or vaping for someone who has asthma?
Well, I would caution anyone to not smoke and or vape, not to mention anyone with asthma. Going back to what causes asthma and the pathophysiology behind asthma, it's an abnormal thickening and abnormal inflammation going on in your lungs. Smoking and vaping only exacerbates that. That only makes it worse. The only thing that should be going in your lungs and coming out your lungs is air. And anything other than that is going to make your symptoms worse.
Very well said,
Yeah.
very well said. So what resources do you provide for patients with asthma?
We offer the entire gamut of resources for our patients with asthma, from early stage asthma to not end stage, but towards if you've had asthma for a long time, we can help with that. So we help with assessment, diagnosis, treatment, and management, and just day-to-day counseling and making sure that we are providing our patients with adequate support. A lot of times that's really all that they need is a little bit of support to get through this disease.
Okay, and how can someone make an appointment with you if they need to?
Absolutely. So we get our referrals via the primary care doctor. So if you have asthma or you know someone that has asthma, just talk with your doctor, talk to your primary care physician, see if they can get in touch with us here at Pulmonary Care at Terrebonne General, and we'll be happy to see you.
Okay, great. Well, thank you so much for sharing that valuable information with us today.
Absolutely.
For more information about asthma or asthma symptoms, please visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alfred, and we'll see you right back here next week.